This is one patient's personal experience. Results are not guaranteed and will vary based on several factors, including the patient's general health and activity level prior to surgery.
Skiing is a huge passion. I ski about 50 days a year. And I was skiing through significant pain on both knees, but originally the left knee. And it was gotten to the point where every day I would get home, I would have to sit on the ground, elevate my leg, ice my knee, wear compression sleeves. So it was taking out the joy of the sport I enjoyed most. And really it was just something that the knee was constantly throbbing. But when I would ski, it got to the point where as the friends who would ski with me would see, I would make a really nice right-hand turn, but a very soft left-hand turn. And it got to a point where it was taking 3 Advil or Aleve before I would do any activity. It was taking them again after the activity to try to help the swelling. And it's just a very uncomfortable throbbing pain that just doesn't go away, but it can be sharp as well.
In terms of getting a good outcome, the critical elements to this are following that rehab protocol. You know, we can do the best work possible from the mechanical, technical aspect of the operation. But that's not what finishes the job. That's the start of the process. And attention to the rehab and completing the rehab process is what ultimately makes a great knee. And so that goes in phases. We've got to get the inflammation down, we've got to get the range of motion restored, and then we move on to other phases. This is a multiple month journey. Peak outcomes don't actually happen till a year or 2 years after the operation. And so with all that energy, with that enthusiasm, with that drive, where that peak ends up can be way up here. Okay, that's amazing. But it doesn't necessarily get there faster.
So I waited till the end of the season and I got the surgery done October 30th. I worked my tail off through physical therapy and rehab, and in less than 90 days, I was on a cat skiing trip in Steamboat Springs. And mind you, it's beautiful, perfect powder. To be able to ski again, and I was already feeling relief and feeling so much better on the knee. And as that ski season progressed, I just kept skiing stronger and stronger, and it was a complete game changer. When I first got on that cat skiing trip, when skiing is probably what I love the most, it brought such a smile to my face to get in and out of this cat and not be whining about the pain that I was experiencing. But it was really when I got into the following ski season and my friend said, "You're no longer talking about your knee on the chairlift as far as the pain, you just keep talking about how incredible your new knee is." And it was that moment where I realized that it wasn't dominating my mental frame, it wasn't dominating how I was approaching the sport I love, and it was really just kind of a complete release. And it's gotten to the point now, and I tell people this all the time, having 2 total knee replacements, and despite my age of soon to be 54 years old, I ski like I'm 25 years old again. And I've been skiing since I was 3 years old. It's been part of my whole life. And it really has become something where I don't even notice my knees. I don't notice that I have total knee replacements. They are basically invisible to me during my activities. So a total game changer to have it be where your mental mind frame isn't thinking about your knees and your pain. It's just thinking about the joy of the love and activity you're doing.